Chapter 11. Harnessing Psychoneuroimmunology. The role of placebo, nocebo, and the therapist's influence. Introduction. Psychoneuroimmunology, PNI, explores the intricate connection between the mind, nervous system, and immune response. As research continues to reveal how deeply our thoughts, emotions, and beliefs influence physical health, the role of placebo and nocebo effects has come to the forefront of recent medical and psychological discussions. The placebo effect demonstrates that a person's steadfast belief in the effectiveness of a treatment can lead to tangible, measurable improvements in health, even when the treatment itself is inactive. Conversely, the nocebo effect shows that negative expectations or beliefs can worsen symptoms or trigger adverse reactions. Within therapy, a skilled practitioner can harness these effects to support healing, not only by administering evidence-based treatments, but also by offering hope and confidence that recovery is possible. The power of belief. Placebo and nocebo. The placebo effect has long been recognized as a powerful testament to the mind-body connection. Patients given sugar pills, saline injections, or other inert interventions often experience genuine improvements in symptoms simply because they believe the treatment will work. This effect is not mere imagination. Biochemical processes such as the release of endorphins, changes in brain activity, and modulation of immune function have been observed in placebo responders. On the flip side, the nocebo effect shows that the anticipation of adverse outcomes can cause real harm. When patients expect a treatment to fail or believe they will experience side effects, those expectations can manifest physically, leading to increased pain, anxiety, or even symptoms unrelated to the treatment. Psychoneuroimmunology and the mechanisms behind belief. PNI explains the underlying mechanisms of both the placebo and nocebo effects. When a person believes in the efficacy of a treatment, the brain activates pathways that influence the autonomic nervous system and the immune system. This connection is why stress, anxiety, and negative emotions can suppress immune function, while positive emotions, hope, and relaxation can enhance it. Neurotransmitters like dopamine and serotonin, which regulate mood and behavior, are influenced by our expectations. Additionally, the hypothalamic pituitary adrenal (HPA) axis, which governs the body's stress response, plays a crucial role in mediating the effects of belief on health. When a person anticipates healing, their body produces a relaxation response, reducing cortisol levels and promoting immune activity. The therapist's influence, a key factor in healing. One of the most critical factors in the placebo effect is the relationship between the patient and the therapist. Studies show that a therapist's confidence in a treatment's success can directly influence client outcomes. A therapist who conveys hope, confidence, and a belief in the strong possibility of healing can trigger positive changes in the client's physiological state, often tipping the balance towards recovery. This is where psychoneuroimmunology and therapeutic practices intersect. By creating a safe and trusting environment, therapists can help clients engage their parasympathetic nervous system, the rest and digest state, where the body is primed for healing. In this context, the therapist's well-placed hope and reassurance become part of the treatment, helping to maximize the therapeutic impact. The work of Dr. Mario Martinez, Cultural Beliefs and Healing. Dr. Mario Martinez, author of The Mind-Body Code, offers a unique perspective on how cultural beliefs and emotional states shape the immune system and the healing process. He highlights how people's beliefs, particularly those influenced by cultural conditioning, can have profound effects on their health. For example, cultural notions of aging, worthiness, and illness can affect how a person experiences health challenges or responds to treatments. Dr. Martinez's biocognitive model integrates psychoneuroimmunology with cultural beliefs, suggesting that healing is not only a matter of biochemical interventions, but also involves challenging and transforming people's deeply held beliefs. For therapists, this means addressing both the conscious and subconscious influences that affect the client's healing process. Hypothetical. The therapist's confidence and client outcomes. Consider a therapist working with a client suffering from chronic pain. The client has seen multiple specialists, tried various medications, and has virtually lost hope. When the therapist begins to instill confidence that recovery is possible, using language that suggests past successes and offering reassurance that the client's body can heal, the client begins to relax, lowering their stress hormones and reducing inflammation. Over time, this combination of therapeutic intervention and the therapist's confident belief in healing leads to a gradual reduction in the client's pain levels. This case illustrates the profound impact of placebo and PNI in therapy. Key takeaways. Belief shapes health outcomes, both positive, placebo, and negative. Nocebo, expectations, can directly affect physical health through psychoneuroimmunological pathways. Therapist influence is crucial. A therapist's hope, confidence, and belief in healing can positively affect a client's physiological state, leading to improved outcomes. Psychoneuroimmunology explains the mind-body connection. Neurotransmitters, the autonomic nervous system, and the immune system all play a role in how beliefs influence health. Cultural beliefs matter. As Dr. Mario Martinez's work shows, cultural conditioning can impact health, and transforming limiting beliefs can aid in recovery. Real-world application. By fostering a therapeutic alliance grounded in hope and reassurance, therapists can harness the power of the placebo effect, helping clients heal both physically and emotionally. Conclusion. The growing field of psychoneuroimmunology demonstrates that the mind and body are deeply intertwined. Belief, expectation, and the quality of the therapeutic relationship can profoundly influence health outcomes. For therapists, understanding and applying the principles of placebo, nocebo, and PNI can enhance the efficacy of their treatments, creating an environment in which clients are not just passive recipients of care, but active participants in their healing journey. References. Ader, R., and Cohen, N., 1993. Psychoneuroimmunology, Conditioning and Stress. Annual Review of Psychology, 44-1, 53-85. https duide.org 10.146/anarev.p s.44.020193.00413. Benedetti, F., Carlino, E., and Polo, A., 2011. How Placebos Change the Patient's Brain. Neuropsychopharmacology, 36-1, 339-354. https sa.adoy.org 10.038 npp.2010.81. Kulika, L. and Miller, F.G. in 2011. The Nocebo Effect and Its Relevance for Clinical Practice. Psychosomatic Medicine 737 598-603. https doide.org 10.097/PSY0. B03E3182-294-50. Martinez, M. 2010. The Mind-Body Code. How to Change the Beliefs That Limit Your Health, Longevity, and Success. Sounds true. Tracy, K.J., 2002. The Inflammatory Reflex. Nature 420-6917-853-859. https://doy.org 10.038/nature-01321. Wager, T.D., and Atlas, L.Y., 2015. The Neuroscience of Placebo Effects. Connecting Context, Learning, and Health. Nature Reviews. Neuroscience 16-7, 403-418. ITPS, duide.org IE 10.038/NRN3976.